So Kathleen, I want to go a little bit into it. A few of you have mentioned cost and food and even safety and maybe not feeling safe to leave the house for a particular reason. So I'm curious if you know about programs with the health plans that you all are using to help address getting food, getting transportation, if you're not able to leave your home, and maybe getting care to come to you or maybe meet your doctor on the phone or on the computer. I know I said a lot of things in there, but I'm just curious if you can talk about the programs you know about that your plan is delivering to make it easier for you to get those necessities of life and your care. Yeah, you want to go ahead and start?
I mean, I know that it's there, but I don't know it's there because I guess of, how they get to you, like addressing it, that it's available. I don't know that it's available because I don't, use it.
So what makes it hard to know? Is it the materials you receive or just the trying
Materials,
to understand?
yeah. Just marketing, saying, hey, you can get so-and-so, I don't know that it's there.
If it's for you particularly?
Yes.
Okay.
Yes.
Okay.
So it sounds like personalization of the materials, like making it specific to you, Danica, would be super helpful.
There's also times like you think, okay, I'll call them and find out. Well, it'll ring and ring and ring, and sometimes you'll get cut off, and sometimes you'll get a person, and this person don't know what's going on. That person don't know what's going on. You get so many different plans too that it can really confuse you to what you're trying to accomplish. So that's another thing. Plus, I don't tend to read very well as far as understanding the situation, so I don't know what the healthcare system could do to help us be more informed.
You mentioned that the reading would video be helpful if they were ever to offer video that explained your benefits, or like just other modes of communication?
Well, yeah, video would be pretty nice if they send out even emails could tell you what's going on with that, and you can read it and understand it a little bit better, maybe.
Sure.
I honestly think it would be, I do have a problem with Connect, sending me messages that says that there's a message and there's not, but I think that if they actually sent messages that were valuable, it would be something like almost your Miranda rights, do you understand what is being said? That would be very helpful, actually, because, like I said, those services are provided. You actually can get a shuttle to your doctor's appointment if you live in Metro Louisville and you reside there, and your doctor's appointment is there. And even if there's some exceptions to that, it takes you to Indiana for a surgery or whatever. It is provided, but it isn't clear that it's provided. And if you're not just reading every detail of a handbook or every detail of something you're checking a box on, which no one does, you sign up for an app, you just, yep, So if you had to actually be responsible saying, yeah, I did see that, then you would actually know. And a video would be helpful. She's completely correct on that. That would be, because we all are kind of visual people now. You have to be told. So, but I do think that in that situation, you just should be yes, I understand, and then you would know.